Okay, today we'll be talking about bacterial pneumonia. Bacterial pneumonia is very simple, and we are going to be talking about the medications also that we'll be using to tackle these bacteria that are affecting the alveoli of the lungs. So please pay attention to this video because you're going to learn a lot, and it's going to help you even as a student. It will help you to gain more knowledge on how to tackle some minor health conditions that you might mistaken as something else. Now, generally, sometimes when someone is experiencing this bacterial pneumonia, you're going to be experiencing something like tightness of the chest. Your chest begin to feel very tightened. Sometimes we mistaken it as angina pectoris. It's not angina pectoris. There is a bacteria in the lungs. Sometimes you find it so difficult to breathe. You find it so difficult to breathe. The reason is not because of asthma. There is bacteria in the lungs. As this lecture goes forward, I will take my time to explain everything about bacterial pneumonia, and then I will talk about the preventions, the causes, how it is being transmitted, and then we now move direct to discussing the medications that will be used to take care of this bacteria. So first of all, what is a bacterial pneumonia? Bacterial pneumonia is simply a bacteria that is being inhaled through droplets into the lungs, which affect the alveoli responsible for exchange of gas, responsible for gaseous exchange. Now, the truth of the matter is that the things that cause this bacterial pneumonia, or you can call it community acquired pneumonia, are things like cough, someone sneeze, kissing. People that like kissing, sharing saliva, especially to an infected person, sometimes mucus, sometimes sharing cups. These are the places where people tend to contact this bacteria. Now, what happens is that when this bacteria gain entrance, now this is the pathophysiology. When this bacteria gain entrance, what they're going to do is that they will go directly into the alveoli of the lungs. And this is where gaseous exchange normally takes place, and they will begin to multiply. Now, what the body does is to respond. The body's immune system begins to respond by sending white blood cells. Sometimes normally call it the macrophages, by sending the white blood cells to that spot. And when the white blood cells get there, they begin to battle these bacteria. In the process of battling these bacteria, the perforations in the alveoli that helps in gaseous exchange begin to occlude as a result of some fluid that is being produced during this process. Now, that occlusion now is what will make you to start having that feeling of being unable to breathe the way you should. So what the body does to get rid of those fluid now is that you begin to cough. Sometimes you cough out mucus, you cough out phlegms. That is exactly what happened. And that is how the immune system combats this particular bacteria. Now, how can we prevent this bacterial pneumonia? It is very simple. Good personal hygiene. You should look at the thumbnail. The thumbnail, you see the prevention, and you see other causes that are listed there. Please, you need to understand that good personal hygiene is very important, because in most schools, this is what affects students. Someone is having a pneumonia, but sometimes due to the signs and symptoms, when we misdiagnose it, we think it is asthma. Sometimes we think it's angina pectoris, all these heart problem. It is not. The difference is clear. Now, let's quickly move over to the medications that are necessary, the medications that we can use to tackle this bacterial pneumonia. And these medications, you have to know about it. These medications are cefuroxime, azithromycin, albuterol. On my last video, I said something about azithromycin belonging to the macrolides. And then I remember I said something again about cefuroxime belonging to cephalosporin, is a beta-lactam. So let's go directly into cefuroxime. Now, cefuroxime is a cephalosporin antibiotics. A cephalosporin antibiotics. Now, the mechanism of action of this cefuroxime is that when cefuroxime is taken after bacterial pneumonia had been diagnosed and cefuroxime is taken, what it does is that it moves straight. And then when it moves straight, it will bind to what is called penicillin binding protein in the side. Now, when it binds to this penicillin binding protein, remember this penicillin binding protein is what will help the bacteria to build their cell walls. So when it binds there, it begins to break the cell walls of this bacteria. And then the bacteria will become unable to survive. They begin to die. That is just a very simple mode of action or mechanism of action of this cefuroxime. Now, this cefuroxime normally comes in 500 milligram. Here is it. It normally comes in 500 milligram. You take it 500 milligram one daily for 5 to 7 days. That is for cefuroxime. But there are other things you should watch out for while taking cefuroxime, something like the side effect. If you're taking cefuroxime, the side effects you're going to be experiencing are things like diarrhea, you experience nausea, you experience stomach upset, rash, headache. In my next video, I will explain how cefuroxime causes diarrhea, and our contraindications are severe kidney impairment. If someone has a kidney problem, please don't go for cefuroxime. Don't go for cefuroxime. And then another contraindication is history of severe immune hypersensitive reaction to penicillin. History of severe immune hypersensitive reaction to penicillin. The next contraindication is lactating mothers, pregnancy, although in this case sometimes it can be used, but a doctor needs to give the prescription. Is very, very important. Now, the reason why we are using cefuroxime, we are using azithromycin. These are antibiotics. Two of them are antibiotics, while albuterol is a bronchodilator. So the reason why we are using cefuroxime and azithromycin to take care of bacterial pneumonia or community acquired pneumonia is simply because cefuroxime cannot kill atypical pneumonia. The only thing that can destroy atypical pneumonia causing organism is azithromycin. Cefuroxime can only attack typical pneumonia, so it does not have that strength to destroy atypical pneumonia. So that is why we are combining these two antibiotics to tackle bacterial pneumonia. So as a student, you begin to feel you're having pneumonia and you don't know how to approach a doctor, you don't have money to run some tests, you can just lay your hand on these two medications for a start to get some relief. Now, for azithromycin, I talked about it in my last video. Azithromycin belongs to macrolides antibiotics. We already know they share similar mechanism of action, and the milligram for this azithromycin is also 500 milligram for a start, that is a bolus, and then others you give 250 milligram daily for 5 to 7 days. Now let's go to albuterol. Remember, this ceftriaxone comes in IV, IM, then oral routes. Then albuterol comes in inhalation routes. Now, for adults on this albuterol, for the inhalation route, you give 2 puff. 2 puff, you do it repeatedly, 4 hours to 6 hours apart. Then for nebulization, what you're going to give is 2.5 milligram in 3 ml of normal saline. You give it over 5 to 10 minutes. That is for albuterol. You're introducing this bronchodilator so that you can dilate the bronchos to facilitate breathing, because the whole essence of everything is to, number one, is to kill the bacteria that is causing this alveoli not to pass as not to exchange gas the way it should. And then the second one is to expand these bronchos that have been constricted by this bacteria invasion. So that is why we are using these 3 medications. But what you should understand is that these 3 medications are not the only medication necessary to take care of bacterial pneumonia, but these are the ones you can lay hands upon to take care of bacterial pneumonia. Now, sometimes people might ask some questions. So on this video, please, I would like you to ask me your question on the comment section. Ask your questions on the comment section. Make sure you like, subscribe, and share this video to help some people who think that asthma, people who think that angina pectoris is angina pectoris, asthma is asthma. Sometimes it's not like that. It is not all chest pain as a result of asthmatic attack or angina pectoris. So that you stop taking lisinopril, amlodipine, all these medications, because you're treating something that is totally wrong. We have bacterial pneumonia. I hope this video helps you so well. Thank you very much for watching. All right.